I watched was Girl Interrupted. The film was set in the 1960s following the main character Susanna, who was 18 years old and part of the middle/upper class. Susanna went to a psych ward where she received therapy and was diagnosed with borderline personality disorder. Borderline personality disorder is characterized by disturbances in identity and impulse control with intense fear of abandonment. Despite the stigmas surrounding mental illness in women in the 60s, based on her symptoms, I believe Susanna was correctly diagnosed. In the 1960s, there were certain cultural expectations of femininity and proper behavior. Women who were perceived as overly emotional, non-compliant, or self-destructive were often more likely to be institutionalized or diagnosed with mental health disorders, while similar behaviors in men might not have been viewed with the same scrutiny in the same way. Susanna was described as promiscuous and argued how men could sleep with as many women they desired without receiving that label. I believe that BPD may not be diagnosed in all cultures. In some cultures, emotional expressiveness, particularly intense emotions like anger or sadness, may be seen as a normal part of the human experience, while in others it may be viewed as a sign of instability or dysfunction. So I feel like Susanna displayed a few different symptoms, one being suicidal thoughts, as she tried to overdose on a bottle of aspirin, which is kind of what put her in the psych ward to begin with. And she just continuously voiced her experiencing suicidal thoughts. And she also presented numerous impulsive and risky behaviors, such as escaping the psych ward with Lisa, where they ran away and they went and stayed with their friend Daisy, and that ended horribly. And she had lots of difficulty controlling her anger as well. For example, when she was thrown in the cold bath and she was throwing a fit and screaming at Valerie, I feel like it's really easy for her to get super angry, and it's really hard for her to be able to come down off of that anger. And she also had a fear of abandonment, which caused her to spiral when Lisa was sent to another psych ward. And she also had relationships with multiple men, which I feel like was kind of her way of trying to, keep those relationships. I feel like in a way, when she kissed the worker at the psych ward, I feel like she had just had that fear of losing him, and so she wanted to take it to the next level, if that makes any sense, to keep their relationship in a sense. So one typical symptom of borderline personality disorder that I didn't notice in Susanna was disassociation. Disassociation might involve feeling like one is watching oneself from the outside, losing touch with reality, or having difficulty remembering certain events. The film doesn't explore the dissociative experiences that people with borderline personality disorder sometimes have, such as a sense of numbness or detachment from their surroundings or sense of self. Considering Susanna attempted suicide, I believe the best treatment plan for her is inpatient care, such as the psych ward where she can receive round-the-clock care and visit with a therapist. Therapy will also be crucial in Susanna's mental health journey, for it will allow guidance and reflection from a professional. Ethical concerns stem from the use of physical restraints to protect patients from harming themselves and seclusion from the outside world, as it could be a lonely experience. Being physically restrained can cause trauma in itself, but is important when trying to protect the patient and others. The medicalization of women's emotion has posed a cultural barrier. In the past, women's emotional experiences were seen as abnormal, and they were more liable to be diagnosed with psychiatric conditions for behaviors which may have been considered gender normative in men, like rebellion or independence. I think overall, Girl Interrupted does a good job portraying the disorder, as it is based off of a true story and real experiences of Susanna Kaysen. It accurately captures aspects of BPD such as emotional instability, fear of abandonment, and relationship difficulties, but it also simplifies and stereotypes the disorder at times. The movie portrays the emotional chaos of BPD, but doesn't fully explore its causes, the treatment, or long-term recovery process. It focuses more on the dramatic elements of mental illness. I believe that the portrayal of disorders in most cinematography is often more focused on dramatizing the disorder and is about creating a more interesting story for the audience. Sadly, this can be very misleading to a naive audience. Thank you!